Well, when you imagine a community-run hospital, you may think that they don't have the resources to keep up with technology or stay competitive in the changing healthcare world. Well, that is far from the case at Licking Memorial Health Systems, where new practices and programs are constantly being added. One of those is neurology. So I'd like to welcome CEO Rob Montagnes along with Dr. Evan Wong. Thanks for being here, guys.
Good morning. Good to be here.
Good morning. Thanks for having us.
Oh, absolutely. Listen, Rob, we're going to talk about how Licking Memorial really isn't your typical community hospital. So you offer so much and these specialties really that you're able to provide Licking County.
Sure. I think, our litmus test is if we can provide a service at a high level, quality-wise, and the population can support that in terms of the volume, we need to make sure that service is available so folks aren't driving extended periods of times or distances. It's not only obviously helpful for the patient, but their support system as well with driving back and forth and all of the additional time it may take for them. So I think of endocrinology, rheumatology, interventional cardiology, and certainly what Dr. Wong has brought to us with his expertise in neurology.
And those are some of the less common ones, like you said, that you really only think of in metro areas, and you're able to provide that right there at home for so many people.
Yes, and I think, once again, it helps the patient, the family, and the physicians because they can refer and know that they can quickly get in locally to have an ailment looked at very easily rather than trying to coordinate that in a different city in a much further health system. But right in our own health system, they can refer to Dr. Wong or one of the other physicians.
Dr. Wong, I was talking with you a bit before the segment, and I find neurology so interesting because so many things are impacted by the brain. Why did you choose that as a specialty?
Exactly what you just said. It's such an interesting specialty. I feel like I've seen a lot of interesting cases, gotten excellent training at Ohio State. And some of the patients, they come in, don't know exactly what's going on. Their primary care doctor don't know what's going on with them. And, it's really satisfying to be able to provide some answers for the patients and potential treatments.
And what kind of services do you bring to Licking County?
So, I see patients on a daily basis. I diagnose them. I see a lot of chronic headache patients. A new service we just started is Botox injections for chronic migraines when patients don't respond to medications and they have headaches almost every single day. We do Botox injections to help with their headaches, and so far we have had a lot of success.
And you're able, obviously, to stay on the cutting edge of what's going on as far as treatments as well. I mean, that's not, lessened because you're at a community hospital by any means, right?
Of course, the first step, I think, is to accurately diagnose the patient.
Sure.
Make sure we have the right diagnosis, and then we go to different steps of treatments. The treatments are all guidelined.
Sure.
For example, if a MS patient comes, we give them steroids, we start them on medication, just like at any other big institution. But I think the good thing is that we have large hospital system within reach in Columbus, in case, if we have a case that needs, for example, plasma exchange, where we don't do it in our hospital,
sure,
then we can refer the patient.
Yeah, it's good to have a lot of connections in this area, but to be able, like you said, to help the patients right in your backyard, get that first step, because that is the most important part. As you said, some of them come to you saying, I've had this behavior for a year and I have no clue what's going on with me, right?
Right. The patient himself, he didn't really think there was anything wrong with him, but he was acting strange. He could not remember the people that he used to know for years. And he cries a lot, and his wife was just very concerned about him. And then it's very satisfying. I able to tell her what I think is wrong with him.
Right.
And then, he just came in, but we're in the process of diagnosis. I just did a lumbar puncture on him yesterday, and they're waiting for some results to come back.
All right, able to help. Rob, how does the health system support all of these in Licking County?
Well, we're fortunate that the community supports us. We're able to do very well financially, and that allows us to attract high-end physicians like Dr. Wong, the rest of the medical staff. And we're so excited when they bring new ideas and ask for new technology. We're happy to make it available to them so they can use it for our patients. So it's a really nice setup, and we're really proud of the work that the physicians do.
All right, absolutely. Congratulations on 10 years as well, Rob.
Thank you. Thank you.
All right, Dr. Wong, thanks for being with us today.
Thank you.